diagnosed late is that they spend time in clinics or with people who are not even medical. So someone takes about 2 years treating a leukemia or a lymphoma or any other type of cancer as malaria or as typhoid. So the social support system or the system in the community, remember I said that community can be anything, from a small to the country to the city. But we also need to stress the issue of funds. Managing cancer is very expensive.
It is.
You and I may not have suffered from cancer before, and I hope we shall not. But there are people out there, even in our own families, who have had cancer. Even those who have cured from it, they have really paid through the nose. It's a very expensive disease that leads to catastrophic expenditure. And it's important that as communities, we plan before we reach that point of people having this deadly disease and they can't manage it.
So emotionally, you know, we also know that cancer patients need emotional support. How do you think the community can actually bring this to them?
Yeah, so among the 5 things that I said, we as a community can offer cancer patients. In there, there's a very big aspect of information sharing. As a people, we cannot prevent what we don't know. We cannot treat what we don't know. We cannot support people in the things that we don't understand. Therefore, it's important that communities are provided with information, not just about cancer, but about disease prevention, disease management, benefits of early diagnosis, benefits of treating diseases well without having to just keep going to pharmacies and getting drugs that have not been prescribed. So that information, they say information is power, you know that.
It is.
So once people are empowered with information, they know what to use that information, how to use that information on themselves, but also for the benefit of other people. You cannot provide the emotional needs to someone if you don't know what it means to have cancer.
That's true.
What it means to even just be told that, you know what, Richard Kalungi, you're now a cancer patient. That statement in itself may need a couple of months or even 2 years for that person to appreciate that, you know what, this is my fate. So you need to first of all understand what it means to be a cancer patient. Number 2, put yourself in the shoes of that person. You know, in this era we talk a lot about emotional intelligence. Put yourself in the shoes of that person. Understand what that diagnosis means to them. But then also in terms of really supporting them physically and directly, understand what their treatment is going to be like. You know, if someone has been diagnosed with cancer and they're going to have chemotherapy, they're going to have radiotherapy, this is treatment that is really strong and it needs a lot of support, a lot of encouragement. So that's what the cancer patient needs from you. And then, of course, most importantly, I need to stress the issue of physical support to these people. They may need the shelter, they may need food, they may need money. You know, emotions are not just, you know, embracing and hugging. Emotions sometimes are so strongly supported through providing the physical needs that people need. Because, you know, health is not just about one aspect of I don't have headache. These things usually in real life happen together. When you give someone shelter, they are emotional at peace. When you give someone food and some funds that they need, they are mentally stable. So it's not just one thing on one side and then the other thing on the other. It's totalistic or holistic support of an individual to go through this dangerous and strong diagnosis with the most support that they can get from us.
Wow, okay. So you mentioned that you are part of Rotary and that there is a cancer run. Tell us a bit about that.
Yeah, thank you very much, Hope. It gives me quite a bit of pleasure talking about the Rotary Cancer Run because it's doing the things that I've just been talking about. The Rotary Cancer Run is a fundraising arm or fundraising vehicle of the Rotary Cancer Program, which is a program in Uganda. And this program has about 5 things that it focuses on. Number 1 is cancer awareness, which I've just been talking about, information sharing. Number 2 is cancer diagnosis and screening, or screening and diagnosis. Because, you know, once you inform people, then they should go to facilities or we should take camps to them to diagnose the cancers, especially those that are very common, like cancer of the cervix, breast, and prostate. Number 3, when we diagnose, then we must treat. So the Rotary Cancer Run, which is the fundraising arm of the Rotary Cancer Program, is raising funds to support construction of a radiotherapy center in Zambia Hospital, which is one of the ways that we treat cancer. So number 4, once we treat, once we diagnose, once we provide information, we need to have a critical mass of practitioners in the community that have this information and provide this diagnosis and care.
Yes.
So the Rotary Cancer Program supports training of medical workers,
Okay.
nurses, doctors, and capacity building in a nutshell. And then finally, the cancer program is big on collaboration and partnerships.
Yes.
And as of 5-6 years ago, we were working with the Uganda Cancer Institute, which is really the big player in the cancer management of this country. And they designated Nsambia Hospital as the cancer treatment center in central Uganda.
Okay.
I don't know if it's central. Some people think that Kampala is not central itself. But yeah, in central Uganda. And the Cancer Institute is now working on having different cancer treatment directorates or institutes in other parts of the country.
Okay.
So we are big on collaboration, but collaboration for the cancer cause. Raising funds to support people, raising funds to equip the facilities that we are building,
Yes.
raising funds to provide the screening and information sharing. And maybe final part on what the cancer run or the program has achieved thus far. The run has been going on for about 12 years. This year we're running the 13th time.
Oh, wow.
And for the first 3 runs, we were able to put up a cancer ward in Nsambia Hospital, which is able to provide all these things that I've been talking about, apart from radiotherapy.
Yes.
And then the other thing that we've been able to do, we know that blood is a very important component in cancer management or even in patients with very severe disease. And the cancer run has supported us to put up a blood bank
Yes.
in Mengo Hospital.
Okay.
We didn't support the whole construction of the blood bank,
Yeah.
but we contributed part of the funds that ensure that that blood bank is available and supporting people that need blood in the communities. Yeah.
Okay. So for those who may want to know, what are the most common cancers that we find in people, especially in Uganda today?
Yeah, so we could look at cancer's prevalence. We call it prevalence in public health, or how common a disease is.
Yeah.
So we could look at it in about perhaps 3 ways. Number one, commonality, or how common a disease is, could be looked at in terms of sex.
Okay.
In women in this country, the commonest cancer is cancer of the cervix.
Oh.
We actually rank highest among the highest countries in the world.
Wow.
With cancer of the cervix. So any lady over the age of 35 that is watching us today, you may really want to screen for cancer of the cervix, because your chances of getting it when you're Ugandan, living in Uganda, are very high. We also see cancer of the breast in women, but I want to tell the viewers that you can also have cancer of the breast in men. Yeah.
Yes.
In men, the commonest cancer, of course, no-brainer, is cancer of the prostate.
Yes.
I don't know what the prostate is in easier English, but men have an organ or gland called the prostate gland. And if you're Ugandan, living in Uganda, and you're a man, chances are that if you really will get cancer, you may get cancer of the prostate. So for any man out there above the age of 40, please go for screening for cancer of the prostate. So that's in terms of sex. But also have in terms of age. There are cancers which are very common in the young.
Yeah.
Like there's a particular cancer of the kidney that we see in young people.
Oh, wow.
Then there's a cancer of the eye that we also see in young people. There's cancer of the muscles and nerves that we saw in young people. I don't want to go so much into the technical terms, but I want them to know it that way. And then, of course, leukemia and lymphoma. These are blood cancers, or cancers of the blood and lymphatic system. Very common in young people. And this is quite important because 90% or more of our community doesn't know that young people are affected by cancer. And by young people, I'm talking of children who are below the age of 13.
Wow.
So you get a 5-year-old with a lymphoma, or Burkitt's lymphoma, very common in Uganda. Then when you look at the adults, again in terms of age, we see cancers like the ones I talked about earlier in men and women, but in addition to cancer of the lung, cancer of the colon or large intestine, cancer of the stomach is also becoming a bit common. We see a bit of cancer of the esophagus and the throat. And then the other one that we usually see in adults as well is cancer of the blood and lymphatic system again, just like the children. They may define the types, but even in adults we can see leukemias and lymphomas. But for particular emphasis in adults, we also see a cancer called Kaposi sarcoma. This is a very important cancer because it becomes very common because of the increased incidence of HIV in our communities. So when HIV went up, we started getting more of Kaposi sarcoma. And it's really just a cancer of the skin, though it may affect other parts like the lung. The third way that we could look at cancer, we've looked at the sex, we've looked at the age. The other way we could look at it, when you talk of cancer, is about region or geographical location.
Okay.
And why I want to talk about this, I already talked about cervical cancer being very common in Uganda.
Yes.
If you went to the US or Germany, it's very unlikely that you will get many people with cancer of the cervix, but you will get several with cancer of the breast. And this is really about how these cancers come up. I don't want to go so much into the science of how they come up, but I wanted people to understand that if you live in a particular area, there are certain diseases which you need to pick concern in because you live in that area. But final point on this is, when we talk about all these cancers, we don't say that everyone and each one will get them. But what you need to take note of as an individual is what's your personal risk. We call it a risk profile.
Yes.
As Kalungi, as Hope, as my mother in the village, what are the cancers that they may get?
Yes.
Either in terms of age, either in terms of sex, or in terms of their medical story. I don't know how many viewers have actually a medical file that that you can see that on this day I was diagnosed with this disease and it may predispose me to this cancer. So it's important that people get to know their medical history or medical story as an individual, and then also understand the familial medical history. What is it in your family?
In your family.
I know this TV is called Family TV, so it's big on family.
Yes, it is.
What is it in your family that you've had? If your auntie has had cancer of the ovary, cancer of the uterus, chances are really high that you may get those cancers. It's not a must. It's high that you may get. So it's better that you know that as a risk that you have, and then take action.
Yes.
We've heard of pop stars who have had to remove their breasts because their risk of cancer of the breast in their family is too high. So that's the point that I wanted our viewers to appreciate.
Okay, I know that most of the people do not even take time to do checkups, frequent checkups.
I've had people saying that, why do I check something that is not disturbing me? But I keep telling people, if you don't test it, you can't know it.
Yes.
But if you don't test it, it's your choice. If it's in there, it will automatically and finally come out.
So I want you to speak to the people and tell them the importance.
So I keep telling people that it's really very hard to get to know the bad news. We actually have a whole session. We can have a whole talk show about how to deliver bad news.
Yeah.
But the other thing that should encourage you, if you have a cancer or a disease in your body, you have it. You can't change it. So if it's the earlier you get to know it, the earlier you get to do something about it, the better. If you keep convincing yourself that, according to what I know, I don't have HIV, even when you've not tested for it, or I don't have cancer, even when you've not tested for it, you're only doing yourself a disservice. Why? If you get to know it late, because it will finally come out, it will be very expensive to manage. Number two, in a country like Uganda, where you live or where you stay, you may not be able to access the services that you need. So you may need to go either in Kampala, or I know your TV is watched by people outside Kampala, or you may even have to go out of the country. So why don't you invest in knowledge, getting to know that you have it, and then invest small money when it's still easier to manage, but also use the services which are available when you still can. I know that many people on the prevention side say, why don't I eat tomatoes and I prevent cancer? Or why don't I eat onions or herbal medicine and the cancer will disappear? You may do all those things, but if the disease is in there and you're doing nothing serious about it, it will finally take you, and it will take you in a very bad way.
Yeah, which brings us also once again to the Rotary Cancer Run. When will it be?
So the Rotary Cancer Run this year is quite special. Like I said, it's our 13th edition. This year it's happening over 2 days.
Oh, wow.
And it's not running on 2 days, but the first day, the 24th of August, in Kampala, is for a medical expo. So we're going to have people in the space of managing cancer, preventing, screening, and treating cancer, supporting people and showcasing what they do. And on the second day, we are now going to have the cancer run. In Kampala, we're expecting about 60,000 runners. The venue has changed from Kololo Airstrip to Uma Parking Grounds, but experience is going to be the same. For anyone that has attended the cancer run before, the experience is just going to be the same. But importantly as well, the cancer run happens in over 40 cities in Uganda.
Wow.
So if you're in Yumbe, if you're in Abim, if you're in Serere, if you're in Kasese, we're actually partnering with the Renzori Marathon in Kasese. You don't have to come to Kampala. The other thing that people need to understand is that you can register Those who have their phones, you can go to www.ugandarotarycancer.org, and on there you can register for the cancer run. You can buy as many kits as you want. The more you support, the more we defeat this disease. But number two, even if you're not going to run, you can still support the cancer run. The registration costs only 30,000. Like we always say, we don't sell tickets. We don't sell kits. You know, this is a kit of the cancer run.
Okay.
Really beautiful. But we don't sell kits. We register to participate in the cancer run. Why do we say that? The money that we get, we are able to put it into the activities that we are doing. I want to rally all the people out there in the country to visit in Zambia Hospital. I want them to see the cancer ward that their donations have put up. And then number two, to see where we have reached with the radiotherapy center. We are now on phase 2A. We have put up some structures. This year we need 4 billion shillings of the 11.8 that we need. So it's big money, but we know with big people, with many people of action out there in the community, we can do it. Once you've registered, you can pick your tickets, your kits from multiple areas. You can pick it at the Rotary Cancer Program offices in Muyenga. You can pick it at the Rotary offices on Nick Building in Kampala, 9th floor. You can pick it at any Centenary Bank branch, any Swico branch, really multiple places, or even any Rotary club. So if I'm walking on Kampala Road and you see me, please stop me and ask me for a kit. Thank you very much.
Thank you so much, Dr. Richard Kalungi. Well, as you heard from the doctor himself, please try to go for a screen test at least. There is a cancer run coming up on the 24th of August.
25th.
25th?
It starts 24th in Kampala, but the real run is on 25th.
Okay.
Which is a Sunday.
On the, let's say, 24th and 25th then.
Yeah.
Yes, so if you can, please try and make it to the cancer run on the 25th of August and make sure that we are able to support our cancer patients out there. Also, if you have time, go to Zambia Hospital and be able to see what's happening around there. Well, that's what we had for you today on Take Note. Indeed, I really hope that you took note of this. And that's what we had for you today at Good Morning Family with me, Hope Nyongereza. Have a blessed day.
Broadcasting from the heart of Kampala.
Good morning, family.